How do you combine benefits and privacy and regulations? This is something that is going to be explained by our next speaker from India, Vice Chancellor of Sai University, Ajith Abraham, with the report Generative AI in Healthcare.
Very good afternoon to all of you. I would like to thank the organizers for inviting me for this important event and presenting some of the research which I was doing during the last several years. I was working in this field for almost 30 years. The initial 10 years I used to work a lot on foundational models, building AI from scratch to understanding how things work. In 2008, I got exposed to some challenging problems facing the society. I got involved in a geriatric hospital where Alzheimer's patients were admitted mostly for taking care of the end of their life. It moved me in different dimensions because these patients, they can't communicate. No relatives, of course. And even medical staffs, they don't want to look after them because it is very tough. So there was a huge turnover of nursing staffs. Nurses, they come, work for a few weeks, few months, they run away. So it was a very complex situation. And then we decided, how can technology be used to ease the situation? So I would say during the last 20 years, from AI, foundational aspects, I started doing a lot of things in healthcare. And the particular project which I was mentioning, we developed a software platform. There is no generative AI in 2008. A multi-agent system, wearable devices using RFID technology, using Wi-Fi, connecting patients with various monitoring systems where a nurse will get alerts if a patient doesn't move for several minutes, or if the patient doesn't interact the way it is supposed to be. So we showed that by having this monitoring system, we were able to ease the workload of the hospital system. A reduction of about 50% paperwork. For example, a nurse would go to the room and then record some incidents. At the same time, it improved the operational efficiency of the hospital system. So today I'm going to give you a quick overview about some of the work which we continued from 2008 until, I would say, some of the ongoing works. If you look at life expectancy, especially during the last 10 years, post-COVID, it is continuously increasing. Especially if you see those dark blue areas, those countries have the highest expectancy. And if you look at North South, West Africa, still we have a lot of challenges. There is a need to improve certain measures so that we can also give all of them equal opportunity to live. So in the next few slides, I will try to summarize what are some of the current innovations in the healthcare field, which, especially with the invention of generative AI, what it has done. From understanding medical images, which a technician sitting in front of a CT machine or looking at X-rays or MRI scans might miss, the generative AI platform can easily pick that, help writing the reports, finding patterns. In a way, it can help to more precise diagnosis. Most of the diseases, especially cancers, neurological disorders, the number of patients are relatively less, and getting data is a very complicated task. Using generative AI, it is possible to generate almost good data which is similar to the data we need, so that we can build AI models which could be useful for detecting such complicated diseases. In turn, supporting radiologists, helping cancer patients, understanding various pathological situations, etc. We have seen how COVID-19 vaccine was discovered. Typically, a vaccine takes 5 to 10 years because you have to do a lot of research, develop the vaccine, do some laboratory testing, take it to clinical testing in a small scale, get various approvals at different government levels, then do some testing in real case, and then finally release it for public consumption. But we have seen how COVID-19 vaccine, for example, Sputnik, how fast we are able to release it from discovery to consumption, few months, less than a year. So AI, especially generative AI, helps us to reduce the time frames, understanding molecular interactions, protein structures, how they dock together. Such simulations and understandings we can speed up using generative AI. Personalized healthcare has taken a new dimension. You can have a doctor in your cell phone, in your pocket. Electronic health records, just by talking to a device, it can note down the prescription, link it with your genomics, your genetic data, your current lifestyle, and give you personalized treatment plans. And personalized means individually, depending upon how you spend your day on a daily basis. So from generalized medicine, we are moving to precision medicine, which has found immense applications in our daily life, especially in the healthcare industry. Virtual assistants from AI chatbots. Previously, we have seen in banks, in some insurance companies, universities, but nowadays you can also see this in hospitals. Depending upon the need of the hour, it can give you a lot of information. It also makes healthcare more accessible. Imagine someone living far away from Moscow in a remote village. It is not possible to get access to a good doctor. But having such devices helps the general public to access and afford to get the best medical care. It reduces the administrative load of the hospital system, can set up reminders, automatic reminders. It helps the doctors to link many things. Otherwise, doctor would have to ask so many questions. What happened to this one? How it happened? Which day? Which hour? Now everything is linked. Electronically, the doctor can see the summary. And it helps the doctors to make better decisions. Using generative AI, multimodal integration from speech to various electronic records, to your genetic data, to images, to various other vital signs, all these can be integrated with the history. Imagine if a patient who is 80 years old might have a huge file, especially if he or she has complicated disease history. And linking all this together is not simply easy. And all these models will support in real time, and with precision medicine, all these things will together help in the best decision making, giving the best health care. Population health management, we have seen towards the end of COVID-19, we have seen how we are able to control the virus spread to some extent. We can predict, given today's data, this is going to move in this direction. So we can allocate resources, do the necessary interventions, set up hospital systems, set up various other logistics. So epidemic management, AI can support in a very big scale by generating various simulations, situations. We are able to understand risk assessments in the best possible way, optimizing resources, and all this will help policymakers, government bodies, etc. So I just want to summarize, especially using generative AI, how much we have come across, how much we have progressed. I would say first is faster image interpretation. From automatic report generation by looking at an image, the radiologist would have to see slices of CT images. It could take several minutes to see all the slices of CT images and see if something is wrong. But using AI, we will be able to summarize it in few seconds, to a couple of minutes. Segmenting those organs which have some problems. Could be cancers, could be some abnormal findings. Focusing on those areas automatically. At the same time, multimodal integration, connecting with various other data points, connecting with genetic data, connecting with previous health history, previous images. And it helps to minimize the efforts by the radiologists. Imagine a radiologist looking at these slices of images for one patient, 10 to 15 minutes. The next patient, imagine the life of a radiologist on a daily basis. Quality enhancement and reconstruction, which is, I would say, the beauty of artificial intelligence. A radiologist, probably after a few interventions, 10th patient would miss something in a CT scan, in a particular slice, or few slices. But having AI in place, there is no room for missing such event. So we have seen various imaging schemes, from X-rays to MRI scans to ultrasound, endoscopy, colonoscopy, PET scans, CT scans, and understanding various abnormalities from cardio for the heart, various musculoskeletal injuries, neurological diseases, and several cancers. So in the next 10 minutes, what I'm going to do is, I'm going to show you some of the research which we have been doing, especially during the last 10 years. And I'll not be able to go into details because I'm going to show you various diseases, what you have done, but you will see the QR code, and if you scan it, you can directly go to the publications, and if you have more questions, you're always welcome to connect with me at any time. So enhancing MRI images using thresholding. So by thresholding MRI images, it is also possible to get more insights of these images which a radiologist or a doctor might not get. So in this case, we were able to categorize ALS patients. It's a neurological disorder, lateral sclerosis. About 85% patients we are able to categorize accurately. Similarly, enhancing MRI images using various clustering methods. So in this case, we used a clustering based on fuzzy logic, which takes into account of imprecision, uncertainty, noise. And basically, we are able to see neurological disorders, specifically Alzheimer's disease. Something is coming. Probably it will take several years to show up in a regular MRI scan. So it is more like you're looking at a cloud and telling that it's going to rain in the next 3 hours. Similarly, looking at an MRI scan, and we are going to say that you're going to get Alzheimer's in the next 3 years. Again, using MRIs, using generative AI with various other schemes, we were able to categorize different types of Alzheimer's. Moving to blood from AML acute myeloid leukemia to sickle cell diseases, we were able to categorize using artificial intelligence. And nowadays, there are even wearables. You can feel the pain and suspect that something is wrong with your nervous system, and probably you need to do some blood works. And imagine if you have blood works and then all these AI platforms, it can help you to easily identify whether something is wrong. So typically what happens in a real situation is all these patients, number of patients getting leukemia or serious blood diseases, they are very few. And typically when you have symptoms of leukemia, you might have only 6 weeks, 8 weeks to live. And if the laboratory takes 2 weeks, 3 weeks to give you a report, by the time the leukemia might have progressed, you might get the chance to live only for 3-4 weeks. So imagine if you can flag something is wrong with this blood sample, needs some quick intervention. So probably that can minimize or give the patient more lifetime. Intracranial hemorrhage detection, strokes is a very common aspect. Again, using generative AI, we are able to categorize different types of strokes. For example, epidural, subarachnoid, and various other categories. Ischemic strokes. So typically these are, I would say, initial samples that something is going wrong. And you file dizziness and then after some time you're okay. And then you go to the hospital and the hospital will tell that everything is okay because it's already cleared out. So the more delay you have in detecting these type of strokes can also give you more problems, because in medical terms, usually they say that ischemic strokes are some initial points where something big is coming. So it is always better to understand this much earlier so that you can be well prepared. So we tested this in few different data sets and we got very interesting results. Similarly, lung cancer detection, various types of lung cancers, and using an explainable AI model. So usually you get results, okay, you got this cancer, but why? Many times we're interested to know why I got these results. So this model also gives some explanations using some descriptors. Colorectal cancer is another killer, especially for men above 50 years old. And generally it is recommended to have this scan, colonoscopy, every year. Men over 50 years. And typically it takes about 12 to 15 hours. You need to clean up your system, go to the hospital, go to the laboratory, the procedure, then the report, analysis. The whole process takes about 15 hours. And imagine if you have to do this on a yearly basis. And if you use artificial intelligence, whether we can do something better. So we did some initial studies. So you can see that on the screen. So polyps less than 5 mm is considered as, you don't have to worry now, but probably we'll wait until the next 6 months or 1 year to see whether it has increased. So using basic AI models, we are able to detect this even better than a conventional radiologist. A radiologist would take several minutes, but a simple AI platform could detect this in a few minutes. We are continuously doing more work in this direction, and now the current work is to detect such polyps just by using CT scans, which means that there is no need for this 15 hours preparation time, but all you have to go to this hospital and take a CT scan, and in 5 minutes, 10 minutes, you will get the report telling that there are no polyps, or polyps are below some threshold. There is nothing to worry. Similarly, cervical cancer is another major killer, and some of our work in this direction has given very good results. Scoliosis detection. So these are, I would say, very minor compared to other cancers or neurological disorders. But again, for children having this kind of vertebral column or spine, it is difficult to give them the best of life. So there is a need to understand these deformalities in the beginning itself. So using AI, we can easily categorize them into mild, moderate, severe, and then flag for further intervention. Lyme disease is a common bacterial disease from ticks found in the bed. It might sound very small, but if you're not giving proper attention, it can spread. It can cause major problems. So just to conclude, I am about to exhaust my time. I will give two sets of summary. First is from generative AI. As you know that most of these models are based on data. So we have sometimes what we call as data bias. Handling privacy and security. Many a times we're dealing with patients' data, so managing this is a complicated challenge. Hospital systems, healthcare systems have their own legacy platform software. So integrating all this AI-based software platforms, tools, is often a complicated task. And also convincing the medical doctors, the clinicians, or the healthcare professionals that this is important if you use this, these advantages. Many times, it takes some time to get them convinced. Ethical and accountability issues. Many times you get decisions from the software, and sometimes whether you can blindly trust the software decisions, who is accountable if the platform or software makes an error. So deploying AI in healthcare requires careful planning, data governance, proper validation. You cannot simply get some results and straight away implement this in a clinical situation. Need to follow all regulatory compliance and ethical considerations to ensure patient safety and trust from the healthcare service providers. From a healthcare perspective, we have also seen a lot of challenges. First is lack of high quality data. So many times it is very difficult to get data for various studies. And many times we don't have sufficient good quality data, very important. Thanks to generative AI, where we can generate very good quality data. They're always concerned about ethical, legal concerns about data bias, and how to integrate this in a clinical workflow, financial barriers, implementation costs. So again, there is a need for robust data governance, more interdisciplinary collaboration. I always see that medical healthcare professionals, they work more like silos. So we need to work together to develop the next generation AI platforms so that we can serve the community in the best possible way. Thank you so much.
Dr. Abraham.
Dr.
Thank you very much for your contribution. That's very important for science and for healthcare. Thank you very much.
Thank you.
Аплодисменты.
A round of applause, please.
Now you can proceed backstage. Thank you. Ваши аплодисменты еще раз.
A round of applause again.
Дорогие друзья, прямо сейчас у нас 20-минутный
Friends, we are having a 20-minute break, after which we are going to talk about how science and government are
покинуть зал. Еще раз напомню, мы
doing things together.